A very good evening to students, parents, RUMC colleagues, partners, ladies and gentlemen. Welcome to yet another exciting session of the RUMC Go Beyond Keynote Speaker Series, a distinguished series by RCSI UCD Malaysia Campus in commemoration of our 25th Silver Jubilee anniversary. Thank you so much for taking your time today and joining us. My name is Raji, Head of Corporate Marketing and Student Recruitment at RCSI and UCD Malaysia Campus, and I'm delighted to be your moderator for today's session. Now, before we get started, I'd like to run through a few items so you would know how to participate in today's keynote session. You will be on listen-only mode and muted throughout the session. Please feel free to submit your questions to our speaker today on the question pane in your attendee interface. You can send in your questions at any time during the event, and we will be addressing the questions during the Q&A session after the presentation. The Go Beyond Keynote Speaker Series is organized in conjunction with RUMC's 25th Silver Jubilee anniversary. The talk features a lineup of insightful keynote sessions highlighting pressing health issues in Malaysia and beyond. The topic for today would be Understanding Dementia, Aging and Memory Loss by Professor Andrew Law, Head of the Psychiatry Department at RUMC. Professor Law graduated in medicine from St. Louis University, USA, Master in Philosophy in Cardiovascular Physiology, University of Cambridge, UK, PhD in Neuroscience, McGill University, Canada, and he also did his postgraduate medical training in psychiatry in University of Toronto, Canada. Professor Law worked as an honorary senior consultant for the Psychogeriatric Service at Hospital Kuala Lumpur, focusing on major neurocognitive disturbances. He has also been providing consultations and educational talks to non-profit organizations in Hong Kong. Deciphering early vascular disturbance as a culprit in dementia pathogenesis has been Prof. Law's primary research interest, in which he has earned an award from the Alzheimer Society of Canada. He has also recently received funding from the Malaysian Medical Association to conduct a pilot study on the treatment of behavioral symptoms in dementia patients by neurostimulation. With the rapid increase in the aging population and a lack of effective treatment, age-related memory loss has become a major health issue. Prof. Law will take us through the different causes of dementia and its disturbing symptoms, and also how to live with memory loss and possible preventive measures. Without further ado, it is my pleasure to invite Professor Andrew Law to address the audience for today. Thank you. Over to you, Prof.
Thank you very much, Raji, for the very kind, generous introduction, and wonderful to be here. I hope people can hear me. Wonderful to be here to have this chance to talk about this very important topic of dementia. Sorry, I'm just trying to get my slides up. 1 second. All right, so I'm going to start the talk by quoting an American actress. She said that people do not realize that Alzheimer's is not old age, and she is absolutely right. Many people still actually think that being forgetful is just part of normal aging, which is totally not true. Okay, and she also said that, also right to say that, you know, there are more and more people getting Alzheimer's disease every day. Now, hopefully, by the end of today's session, I can convince you that getting old or getting senile is not part of normal aging, and dementia is actually an illness. Now, we will talk about the different warning signs of dementia. That is not just being forgetful. And although we cannot cure dementia at this time, we can actually improve, we can do quite a bit to improve the quality of life of patients and also family members. Now, earlier diagnosis usually means earlier treatment and better outcome. When I knew Professor Whitford was going to talk about diabetes, then I wanted to talk about dementia, because these two things are very much related, and I will tell you more about that. Now, basically, cardiovascular health and brain health, they go hand in hand, and better your blood is, better your brain will be. So let's go back to Alina's quote saying that many people will get Alzheimer's disease, more and more people will get Alzheimer's disease. Is very true, and well, we are in a pandemic right now, but if we are not careful and not do anything about this, we are walking into yet another pandemic, and the dementia pandemic. And for this one, we don't have a vaccine for, because more and more people are getting old in basically all the developed countries and also developing countries. So we don't have a cure for Alzheimer's, and therefore you can see that more and more people will therefore develop the illness, and these will be major burdens for different societies. So what is dementia? Well, it's really just an umbrella term to describe a number of conditions that can lead to memory loss and also behavioral disturbances. The major cause is still Alzheimer's disease, followed by vascular dementia, and then Parkinson's disease dementia and Lewy body dementia. They are kind of on a similar spectrum, followed by frontotemporal dementia. There are some other causes of dementia, but I won't mention them. I'll just focus on these ones right now. And I want to kind of mention a little bit more about this concept of mixed dementia. I remember when I went to medical school myself, my professor would be telling us that you really have to do your best to distinguish between Alzheimer's dementia and vascular dementia. But more and more we know about Alzheimer's disease these days. We know that the boundary between vascular dementia and Alzheimer's disease is quite blurry, in the sense that in the Alzheimer's brain, we usually, a lot of times, we see significant vascular damages. Okay, so that's why we have this concept of mixed dementia, because basically it's getting a little bit difficult to distinguish which is actually which. So, about Alzheimer's disease, what is it? Well, back in 1901, that's when Dr. Alzheimer saw the patient Augusti in Germany. Dr. Alzheimer is a German psychiatrist. So by the time that Dr. Alzheimer saw this patient, she was already had significant memory issues and also behavioral problems. And she would often say to Dr. Alzheimer that she was very confused, that she has lost herself because of her disorientation. Now, at the time of her passing in 1906, that's the year when Dr. Alzheimer presented the findings in a medical conference, and that's the beginning of Alzheimer's disease. So what did he find? He found out that there were abnormal proteins in the brain at the time, and now we know that, we know a lot more about these proteins. They actually accumulate in the brain, causing a lot of damages. And when enough damage is done, the neurons, the brain cells, they die, and that's when people develop dementia. Now, let's say if someone is going to get dementia at the age of 75, let's say that, if you look at the person's brain, if you do a PET scan or something, you probably can detect amyloid, this abnormal protein in the brain, 20 years earlier, okay, at the age of 50. But the person will actually be asymptomatic for for a long time, until, like I said, enough brain cells are dead. Then the patient will have the signs of dementia. So what are the early signs of dementia? Now, we often talk about these 10 warning signs for Alzheimer's disease and other types of dementia. First one, well, memory loss. I think we all have memory lapses. I think that would be fine, as long as they're not too often and they are not affecting your day-to-day functioning. Okay, when it does, something is probably wrong. Now, another sign would be, people having difficulty to do things that they normally familiar with. Okay, so but then those tasks become more difficult. Some people might actually have problems speaking with language, in the sense that they have difficulty finding words that they want to say. Another sign would be people getting confused about where they are on the time, on the date, on the day of the month, things like that. Now, judgment can become increasingly poor for people with dementia, and people might have problem in terms of thinking abstractly, so to say. Let's, for example, if you say an idiom, don't put all your eggs in one basket, the person with these signs of dementia might not be able to appreciate the real meaning of that saying. Displacing thing would be another important sign. Now, apart from these kind of memory issues, warning signs for dementias can include these mood changes, behavioral changes, personality changes. Okay, it's nothing to do with memory. Okay, so these things can happen too, and some people become more kind of unmotivated. They don't want to do things. Okay, so if you know someone, or if you yourself having some of these symptoms, probably good to get them checked out to make sure it's nothing to worry about. Okay, now all these cognitive issues, but dementia, Alzheimer's disease as an example, there are these non-cognitive symptoms, these so-called behavioral and psychological symptoms of dementia. Okay, some common ones that I would see in my clinic would be, elderly people complaining the neighbor is stealing from them, stealing things like rice, detergents from their home. And they say that some strangers or even family members are trying to poison them, trying to hurt them one way or another. Spouses being unfaithful to, is another common, very common complaint of these patients with these non-cognitive symptoms. Some of them, because of the circadian rhythm, they are not very good in sleeping at nighttime, and they would wander, and sometimes they get confused, and they will say that, this is not my home. I don't know where I am. I better pack and leave. So they wake up the entire family, and this can happen every night. Okay, and like I said, some of these patients have mood changes, and they become sad, anxious, and they become unmotivated. Now, I think sometimes we joke about how bad our memories are. We must be having Alzheimer's. Yes, we joke about that, but these non-cognitive symptoms, these BPSDs, are really nothing to joke about because they are very common. Up to about 80% of patients with dementia have different types of these BPSDs. They can be very, very disturbing and devastating, especially to the family members. You can imagine, I mean, if someone thinks that the neighbor keeps stealing from them, of course he'll get angry, frustrated, agitated. All these things can lead to aggression and violence. And we have seen patients with dementia actually end up hurting other people, or even killing other people because of the delusions. Now, they become very unmanageable. And therefore, these BPSD is a major cause of people having to go to nursing homes, perhaps prematurely. Now, the silver lining is that these symptoms are usually quite treatable. So, what causes these BPSD? Now, usually there's because of some changes, okay? It could be patient factors, it could be the environment. And you can see here that a number of these different factors, many of those you can't change. The type of dementia, how severe the dementia is, the brain changes, you can't change this. Genetics, you can't change. Your life history, you can't change that, and personality. But you can also see that there are other factors that we can actually help to modify so that these BPSDs can probably be prevented. For example, managing the medical problems as well as we can, trying to understand the patients, knowing that what they want, what they need, understanding the illness about dementia, that would be very helpful for the family members or the caregivers, so that they know how to handle the patients and at least not to escalate the situation when the patient is having problems. So BPSD can be managed. Now, in terms of treatment for Alzheimer's disease, like I said, unfortunately, there isn't a cure. But I think actually what's more unfortunate is that by the time patients actually go to see doctors, the patients that I see in my clinic for the first time are not those who are having those warning signs of Alzheimer's. They are having significant behavioral problems, those BPSDs. They come into the clinic because family cannot manage them anymore. And with that kind of delay in diagnosis, okay, very valuable time has been lost in between. So in fact, there have been studies suggesting that, if you diagnose early and manage early, the outcome can definitely be affected. So usually when a patient comes in and we diagnose the patient with Alzheimer's disease or Lewy body dementia, we usually, if there is no reason for not starting the medication, then we will start the patient on what we call acetylcholinesterase inhibitor. That would help the patient hopefully to slow down the progression of the illness. Now, for the BPSDs, it depends on the symptom. We have other medications for those symptoms. Now, some people might get depressed. We have antidepressants, and for those other behavioral symptoms, the delusions and things like that, we still use antipsychotics to help the patients. Now, they're not the best medication for patients with dementia, but our hands are kind of tied, so we use these medications very carefully. I think the important point here is that if you have a demented patient on antipsychotics, make sure that they don't stay on the medication indefinitely. If the symptoms are gone, it's good to taper the medication off. Now, apart from medication, we also have a number of non-pharmacological, non-drug management strategies for patients with dementia. Now, so what causes Alzheimer's dementia? We talked about those proteins accumulation, but what causes the initial onset of those deposition? That we don't really know. But we do know a lot of risk factors for Alzheimer's disease. Age is the most important risk factor for Alzheimer's disease. And also, I think for most of the other dementias as well. Now, family history, genetics, we talked a little bit about already. It is a risk factor. It can be. Down syndrome is another one, because patients with Down syndrome, they usually have the genetic predisposition to develop those abnormal proteins. These, unfortunately, we can't do much about. They are with us, but head injury is probably one of the modifiable, changeable, preventable factor that we can help ourselves with. And interestingly, cardiovascular diseases are also significant risk factors for Alzheimer's disease. Remember when we talked about the mixed Alzheimer's vascular dementia? Here it is. I mean, these are the risk factors. Being too overweight, high blood pressure, high cholesterol in the blood, high blood sugar, all these things are actually important risk factors for Alzheimer's disease. Now, about 20, 30 years ago, this research group in New York, back then they already started talking about how the association between Alzheimer's disease and diabetes. They even call it type 3 diabetes. Now, they knew that hyperglycemia, high blood sugar, is a risk factor for Alzheimer's disease, and they first studied the model in animals, and then later on they actually showed the same thing in the Alzheimer's brain. They have reduced insulin, and also they have insulin resistance. Okay. 80% of people with Alzheimer's disease actually have insulin resistance or type 2 diabetes. And in fact, when you have brain insulin resistance, what happens is the blood vessels in the brain, okay, for diabetes, when you have diabetes, it's not just your body blood vessels are in trouble, also the ones in your brain as well. So when you have insulin resistance or diabetes, the blood vessels in the brain becomes abnormal, and they are not very good in feeding nutrients and oxygen to the brain cells. And so eventually these brain cells, they die. But again, these insulin resistance, hyperglycemia, they can be influenced. They can be, again, modifiable by different social factors, different various diets, and be active. So just this kind of a busy diagram just to show you how high blood sugar and insulin resistance can lead to cell death, to lead to brain cell death. All of these yellow boxes are in fact different ways, different mechanisms of how high blood sugar can kill the brain cells. Now, some of you might, this diagram is probably good to answer a question that some of you might have on Alzheimer's disease. It has been around for over 100 years. How come we still don't have a treatment? Looking at this diagram, you can see that it is actually difficult to find this magic pill that can stop all these disease processes from going on at the same time. So this is perhaps one reason why we still don't have a good treatment for Alzheimer's. And the current medications that we have, well, they are very much downstream in this pathology cascade. We need to, if we are going to be successful in finding this one agent, we have to go way upstream. And we are not having big successes on that front for the time being. So let's move on and talk a little bit about this very important research study that happened not so long, a few years ago. It's a Scandinavian geriatric study. Okay, we call it the finger study. Over 1,000 elderly participants were recruited. They are at risk of developing cognitive impairment, memory issues, and things like that. So we split the cohort into two groups. One group, we just have regular health advice and regular follow-ups for 2 years. The other group, the intervention group, they were provided with dietitians, they have exercise program, they have cognitive training, their cardiovascular risk factors are also being managed. All these together for 2 years. And after 2 years, when you compare the two groups, the intervention group actually had a lot better cognitive performance compared to the other group. And in that study, they again found a number of modifiable risk factors for dementia. Unhealthy diets, too much alcohol, smoking, diabetes, depression is an interesting one, high blood pressure, obesity, and high blood cholesterol. All these things, do they not sound familiar? We just talked about them not so long ago. So I think some of you are probably here just to want to have this question answered. If that's the case, I'm sorry, I probably would be disappointing you. Apparently, we don't have good answer for these questions. A while ago, we talked about aluminium, zinc being metals that we should avoid, but there's no good evidence that they cause Alzheimer's. There might be a few viruses or bacteria that have association with dementia, but again, nothing really panned out. We talked about, family history could be an issue. Even so, now, even if you are genetically predisposed to having dementia, it doesn't mean that you will definitely get it, because there are modifiable factors. We just talked about a number of them. so that if there's a good chance that you don't develop dementia if you can live healthily. Being a woman has a higher chance, especially postmenopausal women. Estrogen therapy probably help this particular group of people. Vitamins, supplements, there's no good evidence that any of these can prevent dementia, although some people, they have cognitive impairment secondary to vitamin deficiency, like B12, folate. If you correct the deficit, their cognitive performance will might improve. Now, but then they can, but by taking more of the B12 and folate, it's not going to prevent you from getting dementia. Chinese game, mahjong, and Sudoku. These are a very good way to stimulate your brain, and you should do it often. But having said that, they don't prevent you from getting dementia. So, sorry I can't answer this billion-dollar question, but perhaps the question should really be how we can reduce the risk of dementia. Well, we can actually do all these, okay? Exercise, being physically active to either maintain or improve your cardiovascular health. It's never too late. Yeah, avoid, being alone, avoid isolation, even with the lockdown and the pandemic. I think you can still keep in touch with people in different ways. We just talked about these games and the puzzles to keep your brain active, which is important. Healthy diets and a balanced healthy diet. There's no one food that can help you to prevent Alzheimer's, but if you eat healthily, that will actually help your cardiovascular health as well. Now, making good choices is important. We talked about the alcohol already, and smoking is a big thing. I remember there was quite a long time ago, people thought that nicotine was actually a protective factor for Alzheimer's disease, but in fact, that's not the case, because a lot of people who smoke, they die early enough that they never get Alzheimer's. Safe hobbies, I think that would be important. So, and safety measures. For example, if you do ride a motorbike, wear your helmet. Medical checkups are important, and do it regularly. And depression. Now, interestingly, what we have been finding in recent years is that even earlier life depression can be a risk factor for later life dementia. So I think, we're talking about building resilience and managing your stressors. These are important ways to reduce your chance of getting depressed. I'm sorry, it seems like that I haven't told you anything new, but I think that the issue is, while these things are perhaps not new to you, you probably know all these, but are we actually doing this? Are we practicing this? That we includes myself as well sometimes. So I think it's important to remember that we can actually do a lot to reduce our risk from getting being cognitively impaired. So, just to recap, that I hope I have managed to convey these messages to you, that dementia, it is an illness. It's not just simply getting senile. There are different warning signs. Memory loss is not just the only warning sign. So remember that, you know, we can do quite a bit to maintain quality of life for patients with dementia. Okay, having a diagnosis is not the end of your life. Okay, we can do quite a bit, but the key is having an earlier diagnosis and getting earlier treatment. Okay. Now I hope you can remember that diabetes and Alzheimer's disease, they are very much linked to each other. And again, cardiovascular health and brain health are very much the same thing. So I'm going to stop, but before I do that, I just want to salute to all the caregivers and also the family members who take care of patients with dementia. You know, they have a lot of they sacrifice a lot, and they have to. It's probably the most difficult job, and a lot of them, you know, when I see them coming to my office with the patients, I always ask them how they're doing, because if you don't ask them, they won't tell you very much. They need to be this strong people, you know, have the strong caregiver. But if you start talking to them, asking them how they are actually doing, well, some of them, you know, they become very tearful, and they will tell you a lot of things that are bothering them. So if you do know people who are caregivers or family members for patients with dementia, reach out and talk to them and see how they're doing. Make sure that they are doing okay. If they are not doing okay, ask them to get help. Okay, I think that's all I am going to talk about. And thank you very much for spending the time to listen to what I have to say. And I'm happy to answer any question. Thank you.
Thank you very much, Professor Law. That was such an informative talk. And when you said, you know, people at the age of, you know, in the midst of 30s can actually get dementia, although it's extremely rare, that's something new to me as well, because we normally hear people in the, you know, late 50s, late 60s and 70s. But this is a new information. And I think today's talk is, it calls for the importance of creating awareness about dementia, because recently I read that it is estimated about some 230,000 Malaysians will be diagnosed with dementia by the year 2030. It's an alarming figure, and it looks like it's a profoundly life-changing condition. And early diagnosis, it opens doors to future care and treatment, Prof. And so people can plan ahead for themselves or their loved ones to get proper treatment. So thank you very much once again. We are really privileged to have you here, Prof. And let's move on to we have some very exciting questions that we would like to address today. Okay, this one is, right. I have read, hi Prof, I have read that young persons do get dementia. Why is it so? We'll start with that, Prof.
Well, okay. Young people do get dementia, but like you know, Raji was mentioning, it's extremely rare. Okay, when people actually get dementia at a young age, and I'm talking about like in the 30s or 40s, is usually because of genetic mutations. Okay, that these are actually quite rare. So with these genetic mutations, therefore you have a lot more of these abnormal proteins to be deposited in the brain. But it's not something that you really have to worry about, because it is very, very rare. And I don't want to make people feel that, oh my God, any kind of memory issues means I will have dementia at the age of 30. No, it really doesn't happen very often.
Okay, I feel happy about that. Okay, the next question would be, is there a genetic, I think you have already answered this, but maybe you can also, is there a genetic factor contributing to developing dementia? Would this be detected in genetic mappings?
Yes, there are a number of genes that we know of that are very much associated with different forms of dementia. We usually just classify dementia with Alzheimer's disease anyway, the early onset versus the late onset. The most important gene, one of the most important genes for the late onset dementia is the apolipoprotein E gene. Okay, there are different forms of this gene, and some people have this particular form of the gene have a much higher chance of getting Alzheimer's disease than other genotypes. But again, I mean, you can do genetic testings and things like that, but we don't do that because, look, first of all, Alzheimer's, we don't have a cure right now, and even if you're testing positive of having ApoE4, variant, it doesn't mean that you will get Alzheimer's. Okay, so but there's really no point to test you so that you worry for the next 20 years, and in the end you don't get it. So but yes, you can actually test for these genes, but there's really no reason to.
Okay, another question. Can through brain scan or can we detect early warning signs of dementia through brain scan or any therapy? What would you suggest?
Okay, these early signs that I mentioned, so if you have those symptoms, I think it's good to get it checked out. Now, in terms of brain scans, yes, there are a number of different brain scans that can detect different aspects of the brain. For example, if you just talk about CT scan, okay, or MRI, these imaging can look at if you actually have dementia. Some people, not everyone, but a lot of people having dementia, the brain actually will shrink. Okay, so you can see the shrinkage quite clearly for some of these people who have dementia. Now, like I said, a lot of people with Alzheimer's disease, they have these vascular damages, and they can also be easily seen in neuroimaging. I mean, if you even just do a CT scan with contrast, you can pick up these spots of vascular lesions. So if we talk about more research-based scans, well, not exactly research-based, but you can do a PET scan, for example, to look at these abnormal proteins in your brain. But again, even if you have, even if you do the PET scan and scan these proteins, the tricky part is, even when you have this protein, again, it doesn't mean that 100% you will develop or you have dementia. There was another a huge study many years ago now. They look at a number of people, a number of nuns. They look at these nuns who develop cognitive impairment and another group without cognitive impairment. when they die, they look at the brains. A lot of these nuns with these amyloid, with these abnormal protein, they had cognitive impairment. But there's also a group of these nuns, they had a lot of these proteins in the head, but they were they were very smart, and they didn't have any cognitive impairment at all when they were alive. So you see, these proteins, they don't tell you the entire story. So but to I think I'm going off track. But there are a number of scans that we can do to look at the lesions of the brain, and you can do functional MRI to look at neural networks, but that's not really done very much, you know, for clinically. Okay, we do that quite a bit in research, but again, you know, there are these scans you can use to detect these problems. But when you see these lesions, it's probably, you know, it's probably not something that you use to prevent dementia. Okay, and when you have it, I don't know how early the disease stage would be. Okay, some people, you know, might be still at the early stage. They have these changes. That's good, that we can probably do more. But a lot of patients, like I said, they come in too late, and yeah, you do the scan, you see these deficits, but it's nothing much you can do.
I think you
and we
have
don't
answered
really have
yeah.
And we don't really have a blood test for this either.
Okay, you have actually answered a few questions at once. There are some people asking whether there is a blood test, can it be detected through blood tests? So I think. Okay.
No, not really. But we are actually looking at different biomarkers. It's not going to. It's very much unlikely it's going to be one blood test can tell you you will get dementia, you will get Alzheimer's disease. You might want to, if you really want to do something very invasive, some people get the, you know, do a spinal tap and look at the cerebral spinal fluid. But again, it is not something commonly done, you know, clinically for our patients.
Okay, very nice. So we have an audience sharing. I think it's worth me reading this as well for everybody to know. I feel that we need to also look into how this condition is also impacting caregivers. I've once seen a caregiver admitted for hernia. From the social history, he's been taking care of an elderly aunt who couldn't independently take care of herself. A lot of literally carrying her to eat, move around and bathe her, etc. So I think it's also from the point of the caregivers, it's also something to look into, right, Prof?
Yeah, I think this is very sad. In fact, a lot of these caregivers, it could be family members, you know, they really give up their own lives to look after the parents, and sometimes, you know, they, you know, just because they don't want to send the parents to a nursing home, they feel obligated to look after them. But sometimes I would say to my patient's family, now, you know what, if you can actually send your mother or the father to a good nursing home with good staff looking after your mom or your dad, it's probably, you know, you're doing them a favor. Because look at you, I mean, you're not trained, okay, to look after someone with dementia. If you're not trained, why didn't you actually let someone who is trained to look after the person? Now, the tricky part is it's probably difficult to find very good homes in Malaysia, even in other Asian countries. And I personally used to work in a number of nursing homes when I was in Hong Kong, and some of the the facilities were so bad, and I can totally understand why families don't want to send their parents to nursing homes. And therefore, yeah, the caregivers, indeed, I think as clinicians, I think we need to keep in mind that they could be our hidden patients, so to say. And I think, like I just said, we really should reach out to our friends or other people that you might know, if you know that they're caregivers, and see what we can do to help.
You brought up a very, very important point for everybody. Practically speaking, let the ones that have received the training to take care of the patients. So I think that will be more effective in that sense, right, Prof? Okay.
Yeah, I think so.
Would you recommend a baseline brain scan for family members of a dementia patient? I find this very interesting as well.
The quick answer is no. Well, how old are these? It depends on a number of things, okay? But like I said, quick answer is no. But if the person is actually if the family member is is an older family member, okay, or the family member is actually having some of these warning signs, yeah, then I probably would think about it's not really a baseline scan, okay? It's more because there is a problem. Then you might want to scan, okay? Some guidelines for imaging for Canada anyway is we don't really scan a lot unless there's something atypical. Okay, I mean, if you're young, you're 50 years old and you start having these memory issues, yeah, I probably want to scan you. And remember that sometimes, unfortunately, patients can have cognitive impairment, but it's not because of Alzheimer's. I have seen patients that basically showed up with just cognitive impairment, okay, memory issue. That's the only thing. Memory problem, being forgetful, getting worse and worse. But other things were absolutely normal. The blood sugar, everything, blood work, everything is fine. But when we did the scan, what happened was we saw that there was a huge tumor in the head. Okay, this is very unusual. Okay, that the person have a tumor and only having cognitive impairment and no other kind of neurological sign it's not common, but it can happen. So again, I mean, I wouldn't go and just do a baseline scan if I don't have any problem. But if there's a combination of factors, then yeah, you might want to do that.
Take one last question before we end the session today. Will dementia occur if a patient has a minor stroke?
Yes.
I think what she's asking is does it increase the risk of dementia?
Yeah, definitely. People have minor stroke, or sometimes what we call TIAs, transient ischemic attacks, basically. One minor stroke, yes, that itself can actually increase the chance, but usually what happens is these patients with minor stroke, they usually might have more than one. Okay, and the more of these that you get, okay, the higher the chances that you become cognitively impaired. definitely. And again, I mean, this is why managing the cardiovascular health is so important. And in fact, people with major stroke, they can have dementia as well subsequently.
Thank you very much, Prof. I think you have shed light on, the very important questions that some of our audiences have asked today. If you have more questions, you can actually write to us at enquiry@RCSI UCD Malaysia Campus. And once you leave the session, you will receive a short survey on today's event. And we would appreciate if you could complete that and provide your feedback. So until we see you again for the next keynote session, thank you very much for joining us. On behalf of RCSI UCD Malaysia Campus and our speaker, we would like to wish you a very good night. Take care and stay safe.
Good night, and thank you again.
Thank you very much. Bye.